Good morning, everyone. I'll be talking about artificial intelligence in healthcare. Let's understand why AI came into existence or what was the practical implication of AI. Like there are like 7 billion people alive today, which means more people alive right now. They are consuming more resources and requiring healthcare more than ever before. This astonishing fact highlights the incredible challenge that modern medicine faces in serving an ever-growing population. Any process which is scalable and repeatable. For example, let's take a shoemaker. There was a shoemaker who was there 100 200 years before, who used to regularly make shoes in repeatable fashion. Now he is being replaced by a more efficient machine which makes shoe at much more cheaper cost, much more rapidly when compared to a shoe. So any process or any technology which needs scalability and repeatability is taken over by artificial intelligence. So right now there are more and more shoes, but there is no more shoemaker. So this would be a very good time to buy shoes, but obviously a bad time to be a shoemaker. Do you know that we are in the middle of the fourth industrial revolution? We used to read about industrial revolution in our textbooks, in our history textbooks when we were children. Do you know that right now we are in the middle of the fourth industrial revolution? The first industrial revolution was on the advent of steam, which was somewhere in the 1750s to 1800s. Do we see a steam engine anymore? No, there is no more steam railway engines which are seen anywhere in the world except for toy machines which are seen. Second industrial revolution came with the advent of electricity, which was somewhere between 1800s and 1900s. And the third thing was with computers. So even with computers, if you see, earlier we used to have large CPUs. There used to be a desktop. Now hardly any type of desktop type of computers are seen. Now the fourth industrial revolution is happening today and now. Right now we are in the middle of the fourth industrial revolution. We have to acknowledge and understand that artificial intelligence is the next, or it is the most important thing which is happening right now. Now coming to what exactly is artificial intelligence and how it differs from computers. So for that we need to understand something called deep learning. So for something to be intelligent, it needs to process the data and it has to tell us what it means. So now data can be of two types. Either it can be a structured data or unstructured data. A simple example for a structured data is going to be a blood pressure monitoring. Blood pressure is 120 by 90. Blood pressure is by 200 by 120. So you say, yeah, this patient is going to have hypertension. So it's very easy to processes structured data, which is what the computers were doing. In the previous industrial revolution, when computers came into play, structured data was being consistently used by computers to make us understand what we are dealing with. It could be in the process of Excel sheet where we still use it to identify and interpret data. But right now we have moved from structured data to unstructured data. What exactly is this unstructured data? Unstructured data includes text, audios, and videos. For example, it is able to understand a video, it is able to understand a film, it is able to understand an image because it has enough number of images for it to interpret it. It has been given thousands and thousands of images for it to understand, yeah, this is what it is. So that is unstructured data, which can be either audios or text messages or videos. To be very truthful, this we have moved on from the age of artificial intelligence to machine learning to process of deep learning. Let's see what exactly is the difference between these three. Artificial intelligence is when machines and programs were given important instructions and algorithms with which they were able to understand what was happening. Understanding, that is the keyword to this entire talk. It was somewhere in the 1950s and 1970s. Now we have moved on to something called machine learning. Machine learning is the machine is able to learn of its own with few inputs from the external source. What is external source here? Here it's going to be human beings. So the machine is already in the process of learning a process. It can learn how to identify images. The only thing that you need to do, the only thing that you need to do is to tell the machine that these are the problems in it. These are the errors it has made so that it can correct itself and go. Now we have moved on from even machine learning the last decade to deep learning. Now, what is deep learning? To put it in simple words, it doesn't need the help of a human being because it has its own deep neural network which is unable to understand, accept its mistake, rectify on it, and keep moving on. Let's see the difference between machine learning and deep learning. This requires structured data. We saw what was structured data. This doesn't require structured data. This requires human interventions for mistake, whereas this does not require human interventions for mistake. There's something called CPU. Here we use something called GPU, which is even a bigger kind of a processing unit. It takes seconds to hours to come to a conclusion, but this takes weeks and months of interpretation. The process of learning itself is more strenuous and more robust when compared to a machine learning process. So it helps in forecasting, predicting other simple applications, whereas here it is complex applications like autonomous vehicles. Where have we seen deep learning? So deep learning is seen to identify the present implications. Is used as a personal assistant. It can control a robot. A robot doesn't has a brain. It follows the orders, whereas a deep learning can control a robot. Self-driving cars, Tesla cars, where the car is able to drive of its own with minimal input from the human being. Image recognition, this is something that we see in radiology time and again. Identifying fraud patterns, to be very honest, sometimes we occasionally see when we are making a net transaction, can you identify the number of lampposts? Can you see whether there is a dog which is there in this image? Actually, the machine is able to very clearly identify which is the dog. The only thing that the machine wants us to see is we are going to do it at a much slower pace. It is going to pick it up at the speed of 0.01 second. For us, it will take 2 to 3 seconds to identify amongst the 9 slots which are the images which are going to have dog. So based on that, fraud detection is identified. I was under the impression that we are more intelligent than machines for us to identify that this is the image of dog. No, it is not the scenario right now. It can identify it. It can identify it faster. The only thing is we are going to identify it slowly. So based on that, it is going to identify fraud detection. It predicts behavior. Advertising, you see, if many of the times when we are scrolling through Facebooks, we would have been interested in a cloth or in shoes, and there's a pop-up message which comes. Do you want to identify which are the shops around you in which you can go and buy shoes? So that is the implication of AI. There is a process of AI which is working in the background. Okay, this guy is interested in shoes. Let us help him out. Whether it is really help or not is a question for another day. How does it do? So in deep learning approach, see, it gives three images. The cat and dog and the badger are nearly similar because all of them come under the feline category of animals. Repeatedly, it keeps identifying itself. It repeatedly tries to identify the dog. It repeatedly makes error, and at one point of time, it is able to correct itself, and it is going to identify, yeah, this is a dog that I'm going to deal with. Do we see deep learning in our day-to-day process? Yeah. So this is an example of how a Tesla car looks. So the Tesla car has asked the human being, you be quiet, I'll drive. I don't need any inputs from you. I am deep learning. It identifies the trees, it identifies the vehicles which comes, it identifies the roads, it identifies the various obstacles, and it takes a program algorithm to stop and keep moving forward. This is very important because this is the start of a new era of technology where machines have always been considered to be the master slave process. That's what we call it. It's considered to be a slave. Do you really think here the machine is a slave or the human being is the slave? Based on the inputs, based on the higher end capacity which is taken. Here the machine is obviously taking a supersedence when compared to the human being. This is being practically used. Deep learning is being practically used in Tesla cars right now all throughout the world. So the real problem is not whether machines think, but whether humans do. We need to understand what artificial intelligence can do to our lives, the impact it has. This is a very good example of it. For example, there's a scientist who's sitting and telling, yeah, you need to cure cancer. That is a good thing. But what is bad is taking over the world. See, super intelligent machines with the deep learning can control strategies. They can control teaching. And what is the machine saying? Yeah, sure, I promise. But can you hook me up to the internet now? There is a disconnection between the power source and the machine. So it's asking, can you connect me to the internet? Can you give me my power source? See the ways in which it is looking. It is having an uprolled eyes. So that is the introduction of AI. Let's talk about how AI is being used in radio diagnosis. So we already saw structured data, we saw unstructured data. In radio diagnosis, there are two important unstructured data we do. One is images. There are lots of images that we process. Second thing is generating reports. Reports, understanding language itself is a huge comprehension kind of a problem. They usually say thoughts are given to conceal words. Words are given to conceal thoughts. Yeah. So language is far more different. When someone says, yeah, this is correct, this is wrong, this is, yeah, do well, there is a deeper understanding of the language that needs to be done, which is being done by the computers right now. Simple example, there is a patch which is seen in the left lower zone. AI identifies this patch based on the number of images, like 1000, 2000 images or millions of images are fed to it. And it's able to know, oh, yeah, when compared to the right lower zone, there's a patch in the left lower zone. And it detects and picks it up. And in the next process, it takes multiple factors into account, not just the image. There are nodal opacities, there are air bronchogram, there is deviation of trachea, migration of right hemidiaphragm, there is a cavity, there is a reticulofibrotic changes. With these images, it is going to take the history. Did this patient have a history of fever? Did this patient has 2 weeks of more than 2 weeks of symptoms? What are the priors? Whether this patient has already had any chest X-rays. When all these multiple modalities are taken into and fed into the artificial intelligence, it's called as multimodal AI, which is what is being done right now in imaging. So it detects, it analyzes, and synthesizes the data for us to interpret. So this is the data. There are various tools which are fed into it. There's a multimodal agent which is going to interpret the data for us. To top it, it is going to give a clinical context also. For example, if there's a gallbladder wall thickening and it has enough amount of research to understand, yeah, gallbladder cancer is more common in Bihar, then it says, yeah, this GB wall thickening is not just a cholecystitis, it could be a case of a gallbladder cancer. So the patient demography is also taken into account in the interpretation of the final diagnosis, which is being right now done by deep learning. Let's see actually how some real world uses of AI is being done in imaging. So this is a patient in whom by automation, what has happened, we are able to see that entire image like the liver, the kidney, the spleen, all of them are segmented and it measures from the dome of the diaphragm to the inferior, it is this size and it is giving those values to us. So, and it makes, like for example, it takes us a liver span which is around 9.7 centimeters. So it questions itself. So could this be hepatomegaly? No, it is fed the data like no more than 15.5 or 16 centimeter. You consider it to be a hepatomegaly. That is an inferior rounding. You take it as an hepatomegaly. So that is a level of interpretation which is being done by AI right now. What is the error? It is in the process of 0.0 to 0.1 centimeter as far as automation and measurement, segmentation and measurement is concerned in imaging. This is another example of AI. Here we are able to see there is a hemorrhage. The hemorrhagic areas are identified as red areas. So this is by 5C. What they do is they are able to generate. See, a report is being clicked and the entire report is being generated. There is no human being which is needed or least of all a radiologist which is being needed, and they say it is SDH is the subdural hematoma, parenchyma, and extensive reports are being given. Linear undisplaced fracture in a matter of seconds. And what happens? It submits this report to the doctor who has referred it. So that is far as CT brain is concerned. So it can take the measurements of the spinal canal, which is being done here. I don't want to go into the details of it. Based on blocking mechanisms, deconstruction, it is able to. The second important thing is, so earlier we saw segmentation, we saw reports being generated by artificial intelligence. We saw measurements being taken. Second thing is augmentation by leveraging fine-tuned large language models for generating comprehensive diagnostic reports. So one of the hallmarks of radiology, or the difference between two radiologists, is seen by the extensive areas of report. Let's see what is happening here. Dr. Kiran, she's saying, hey, Bionic, generate a report. She has gone through those images. She says, yeah, there is a hepatic hemangioma. There is a renal calculus noted in the upper pole of the left kidney. So once it has fed this thing, a huge report is being generated by artificial intelligence, in which the only thing that has to be done is the size needs to be taken. Even the size is being taken. Here the size alone needs to be fed into the system. What happens then, she says, generate a full report, including the rest of the systems. So now what you see, the entire report is being generated up to down. So it takes lots of factors into consideration. It takes a human scoring system based on which these reports are being developed. We could have seen the difference between Dragon and Augneto itself. Like Augneto is a more efficient mechanism. From Augneto, we are moving to something called a bionic report. Coming to preventive medicine. Preventive medicine, AI products are shaping the future of preventing diagnostics. So here, this is a classical example of multimodal AI. It takes the image, it takes the history. Based on it, it's able to divide it either into an acute infection or a probable old tuberculosis, depending upon the number of findings which are present. Based on that, it is going to give you whether it is active infection or probable tuberculosis or old tuberculosis. This is a typical example of a AI-driven mast cell checkup. So based on the history which is being used by Apollo 1, chest radiograph findings are given. Right segmental lobe consolidation, numeric effusion, left middle zone. See, these are a list of pathologies it's able to identify. Hydropneumothorax, hypoplastic ribs. The list is extensive, around 50 to 60 diagnoses. It's able to make of its own in a plain chest radiograph. It also tells you, know your scan, what it means, why it matters. Left middle zone linear atelectasis, how does it look? And it draws a picture also to say, okay, this is because it's a complicated. Atelectasis is not something that is normally understood by a lay person. So it says this is how a collapsed alveoli look, this is how a healthy alveoli look, this is how an atelectasis looks. To moreover, you just scan this QR code and you send it. So this is how it is made. Another classical example is bone health screening. Here it is taking the radiograph, it is taking four important things: osteophytes, reduced joint space, sclerosis, and post-operative findings. It is identifying all these findings based on the images which it has with itself. It is grading it. Yeah, it is having a left knee joint which is having this finding, right knee joint which is having this finding. What is the alignment? What are the post-operative changes? And based on that, it is giving a detailed report. It grades. It is a grade for osteoarthritis. What you need to do: go on a high priority for further assessment. Contact your doctor. It calculates whether there is an osteopenia or osteoporosis. It gives a small insight into it. 40% of females will have this kind of person. You needn't be worried. There will be joint deformities. What are the guidelines for it? You need to do these exercises. What are the preventive measures that you'll have to take? Calcium, vitamin D, everything, which is being generated by a report. Just compare this thing with the single line report that I give, OA bilateral knee. This is another classical example which is being done right now in Apollo Madurai in our mast cell checkups. So we have multiple panels. The yellow things are the one which are going to come in deep in the future. Our chairman is quite interested in AI and its implication in healthcare actually. So let's see. So this is a patient who has come. Based on the clinical history, automatically these are the tests which are being generated. This is being right now used in our mast cell checkups in Apollo Madurai, where all these investigations are being sought. Then a special test. What are the other tests? Like you need a cardiac test, cardiac marker. Based on the history. Based on the history, it is going to develop. Moving on to the next step in ophthalmology. So in ophthalmology, the most important thing, one of the important things is diabetic retinopathy. So it has images how retina looks without diabetic retinopathy, with early diabetic retinopathy, mild non-proliferative diabetic retinopathy, moderate severe, and proliferative diabetic retinopathy with neovascularization. What it does is it teaches the system or teaches a computer that this is how an optic disc looks, this is how an arterial looks, this is how a venule looks, this is how an hemorrhage looks, these are how hemorrhages looks, and this is how an exudate looks, and this is how microaneurysm looks. So each and every particular finding is called as a feature. These features are extracted from the images, and these are compared with the lesions. So it will have enough number of optic disc images for it to compare this optic disc with the feature it has extracted, and it is going to tell you whether this patient is having an optic disc pallor, whether there is an aneurysm which is present. And based on that, it gives an action plan also. If it is non-proliferated diabetic retinopathy, it says go for an annual health checkup, no intervention, blood sugar level. Whereas if it's a proliferated diabetic retinopathy, it says intervention is required, go for a monthly health checkup, try to meet up your ophthalmologist immediately. Nursing care. So this is a machine which is being used in our Apollo Madurai in a C1 wards. So this is a dozy bed which is being connected to the undersurface of the bed. Let's see how it works. So they keep a sensor which is just beneath the bed of the patient, and there's another sensor which is kept below it. And there are like one lead for the temperature monitoring which is kept at the axilla so that the core temperature is measured. There's another detector which is monitoring the SpO2. What exactly happens? Let's see. This process is called ballistocardiography and artificial limb. Based on the movement which is happening in the heart, all these movements, around 30 to 33 movements which are happening in the entire body, right from the movement of the heart, the cardiac stress, is all captured by the device which we saw earlier. And these pulsations, these movements are then transferred to this particular machine which is standing by the side of the patient. It is called a pod. And from the pod, what happens? All this data are transferred to a database, cloud, where it is going to identify the various important parameters in the patient. What are these parameters? I'll show you. It includes blood pressure, it will include SpO2, respiratory rate, and vitals are being monitored based on this. Now, the simple and important question that came to me is blood pressure for a long time. This is how we have been monitoring. There needs a stethoscope, there needs to be a sphygmomanometer. BP is a product of cardiac output and peripheral resistance. How did we end up capturing the blood pressure without a cuff in this patient? There's something called ballistocardiography. What exactly is this? Is based on the movement of the heart, waves are generated, HIJKLM kind of waves, which is going to correlate with your systolic phase and the diastolic phase of a blood pressure. It's an indirect way of checking the blood pressure. And this is not something new. This is being done by astronauts in space centers like NASA, where they want to check the blood pressure of an astronaut without having cumbersome and lots of cuffs and stuff attached to the arms and legs of the patient. So this is called as ballistocardiography, in which based on the movement of the blood in the heart, the cardiac recoil, the deceleration impact of blood on great vessels, and the downward deceleration impact on the peripheral resistance, all these are converted in movement waves which correlates with the blood pressure. Obviously the first particular blood pressure is being taken by the nursing staff. So let's compare this ballistocardiography kind of a non-contact blood pressure with the two remaining blood pressures which we already know. One is the non-invasive blood pressure. Second thing is the A-line BP. When we do a procedure, cardiac procedure or an IR procedure, we connect it to the peripheral line to see what exactly is the blood pressure. If we compare the blood pressure between these three, the most sensitive or most direct reflection of blood pressure is going to be the A-line BP, which is shown here as the yellow marker. The non-invasive BP, which has been used conventionally for the last 100-200 years, is shown by green. And just imagine ballistocardiography, this is more closer to the A-line BP than the non-invasive BP. So it tells us the blood pressure based on the movement, but the first important blood pressure has to be calculated and correlated by the nursing staff. So if this much movement is happening in the heart, then that can be converted to this much amount of blood pressure. 3 patients, let's see a classical example of what happened. Continuous monitoring happens every 1 or 2 minutes in a patient who has been admitted in Apollo using these AA devices, and based on this patient has been shifted to ICU. Let's see. This is a patient in whom we have taken the readings every 2 minutes, 3 minutes, there are readings. It has a critical point, there's a warning point. For example, if the pulse is more than 110 or less than 50, it says, it gives a warning signal. And if it is more than 130 or less than 41, it gives a critical alert itself, where it says shift the patient immediately to ICU. So these are the various parameters, these 5 or 6 parameters: pulse, respiratory rate, SpO2, temperature, blood pressure, heart rate variability is being monitored electronically without the use of any nursing staff by these devices. The first reading of blood pressure alone has to be calibration. So the calibration part alone needs a human point. Remaining things is already taken over by the patient. So this, let's see what has happened to this patient. This patient has a low BP at around 9 a.m. There was a warning signal which was given. 9:07 the same day night, there was a critical alert which was again high pulse, high breath rate, and low SpO2. Let's see what is happening. So at around 8 o'clock, the pulse rate started shooting up. It went to 150, then again it started dropping to 90. SpO2 also started taking a drastic downfall at around 80. So once it documents, this is being done every 2 minutes. So normal nursing will, at the maximum, will be able to do twice or thrice a day. This machine is monitoring the SpO2 every 2 minutes, and once there is a drop, it immediately gives an alert signal and it asks the patients to be shifted to ICU. In surgery. So earlier we had freehand surgery. We had the luxury of opening the entire abdomen, removing the gallbladder. Now it became laparoscopic cholecystectomy, in which a small incision is being made and then we are able to remove the gallbladder. Now we have moved on to robotic assisted surgery, in which instead of the hands being performed, there is a doctor who is sitting, who's telling you go and remove this gallbladder at this point. There is a machine and there is a human being. In the future, when there is full automation, there won't be any doctors around. There will be just a machine who will be sitting and operating. So right now we have robotic surgeries in many parts of the world right now. We are moving from robotic surgery to AA surgery. AA surgery is being used for preoperative planning, intraoperative guidance, and surgical robotics. It gives in clear-cut intraoperative guidance of where exactly the artery is, where exactly the common hepatic duct is. It helps in identifying the implants which needs to be given. So that is the role of AA for surgery. So right now, it is in the process of development. In another decade, it might be fully flourished. Coming to the most important aspect of the talk. So now we saw how AA helped in patients. So what is the impact of AA to healthcare providers? Are we going to be replaced? Are we going to be outdated? I love this quote from J.K. Rowling in Harry Potter. Understanding is the first step to acceptance, and only with acceptance can there be recovery. So you need to understand this is the implication of AA. This is not a scare. This was a depressing enough talk for me, because when I went into AA and I saw this thing, I understood that it is actually much more smarter. This is something that is an efficient replacement, and we need to understand this. And only with acceptance can there be recovery of what needs to be done. We need to figure out what is our role in the healthcare system at this point of time and how to help the technology and move forward. Out of the top 4 jobs which are going to be replaced, first one was banking. That is a person who's sitting and collecting money and saying, yeah, there is 1 lakh rupee. His job is not going to be there in a couple of decades, 1 decade maximum. The fourth one was going to be nursing. Fifth one was going to be physicians. You saw a classical example of how nursing might get impacted. Except for the first reading of blood pressure, the remaining thing is being done by the machine. The only thing that is remaining is compassion. And this is actually a double-edged sword. For example, if there is a surgeon who's like a little bit depressed that his previous surgery didn't go on well, do you feel that at that point of time, a machine with no emotions is better, or a surgeon with full-fledged emotions is better? It's a point of contention. So where are we? Have you considered becoming a robot? So I am going back to my previous slide. This is a good time to buy more and more shoes. If you want to be in healthcare system, if you want to get a report within matter of seconds, reports are being generated. Within matter of seconds, images are being interpreted. what happens to the shoemaker? What happens to the radiologist who has been practicing radiology, who has been learning radiology, leave practicing? Someone has been learning radiology for the past 15 years, MBBS, MD, DM, everything put together, 15 years, and now they say there's no more need for a shoemaker. But we can generate more and more shoes. This is a good time to buy shoes and a bad time to be a shoemaker. So what do we do? I like to refer to this particular TV series. This is called a three-body problem. And I'll just give a crux of what happens in this. So the world is taken over by Santi. These are basically aliens who are 400 light years or 500 light years apart. They are traveling to Earth, and the entire human civilization is going to be dominated by them. So now, whatever is being spoken, whatever is being communicated, whatever technology is being under the control of the AS or is under the control of the alien system. So in this, I urge you to see this episode. There's someone called Avenji. She's trying to communicate something to the other engineer. He's Saul. He's one of the top-notch engineers in the world. She's trying to tell him a mystic code. So hereafter, even communication might be in the form of a joke. And obviously, this guy doesn't understand it. And the purpose of communicating it in a process of joke is something that might not be understood by the AI power or by the aliens. So she's trying to communicate it, and she ends up killing it, getting herself killed the very next day for having communicated this thing. So we need to be cautious about AI. So this is 5C team who have been helping me with the presentations, and most of the reports which I showed you were being done by this team, Mr. Bhargav and Kishore and Kalyan. He's head of AI in 5C. My sincere thanks to Dr. Palniappan sir and team Apollo Madurai for giving me this wonderful chance and opportunity to talk about AI, to understand about the role of AI in healthcare and what we need to equip ourselves. So we need to learn more and more about identifying what is our role in AI and how to get ourselves into AI so that we do not get outdated over a period of time. So if you don't know something or if you really do not understand something, the thing to do is not to get scared actually, but to start learning. Thank you. Good morning, everyone. I'll be talking about